You lie down at night, and your legs start to swell. Maybe it's your feet that look a little puffier after you've put your feet up. Maybe it's your ankles that feel tight, or your calves that feel heavy and full. And you wonder, why does it happen at night, when you are finally resting? If you have been noticing that swelling, you are not alone. And more importantly, you are not imagining it. The body is actually telling you something very specific. Before we go deeper into this, if you are finding this explanation helpful, please consider subscribing to the channel. We share clear, step-by-step health information every week, and subscribing is the easiest way to make sure you do not miss the next video that could answer another question you have. Just click that subscribe button below. It helps us keep making these videos for you. Now let's look at what is happening. Swelling in the legs at night is usually not a random thing. It is often a sign that your body is holding on to extra fluid during the day, and when you lie down, that fluid starts to shift. To understand it, we need to think about gravity. During the day, when you are standing or sitting, gravity pulls fluid down into your lower legs and feet. That fluid is mostly water, but it also contains small amounts of salts and other substances. Your body is very good at moving that fluid around, but sometimes the system gets a little overloaded or a little slow. Think of the circulatory system like a network of rivers and streams. Your heart pumps blood out through arteries, and that blood carries oxygen and nutrients to your tissues. Then the blood returns to your heart through veins. But the return journey is against gravity, especially in your legs. To help that blood come back up, your veins have tiny one-way valves that open and close to keep the blood moving in the right direction. When you are walking or using your leg muscles, those muscles squeeze the veins and help pump the blood upward. That is why moving around during the day is so helpful. When you are resting at night, those muscle pumps are not working as actively, so the blood and fluid can start to pool in your lower legs. That pooling is part of why you notice swelling more at night. But there is another important piece. Your kidneys are responsible for balancing the amount of fluid in your body. They filter your blood and remove extra water and waste, which becomes urine. During the day, when you are upright, your kidneys work a little differently because of the pressure changes in your blood vessels. At night, when you lie flat, your kidneys often start to process more fluid. That is why many people get up to use the bathroom more at night. But if the kidneys are not able to remove that extra fluid efficiently, or if the body is holding on to too much fluid for other reasons, then that fluid can build up in your tissues. And when you lie down, that fluid can spread out more evenly along your legs and even into your lower back and abdomen. So the swelling you see at night is often a combination of fluid that has been sitting in your legs all day, plus fluid that your body is not processing quickly enough when you rest. Now let's be more specific about what is happening in your legs. The medical term for swelling caused by fluid buildup is edema. Edema is not a disease by itself. It is a symptom that something else is going on. The swelling usually starts in the feet and ankles because gravity pulls the fluid down to the lowest points. If the swelling moves up to your shins or knees, that often means the fluid buildup is more significant. And if you press your finger into the swollen area and it leaves an indentation for a few seconds, that is called pitting edema. That is a clue that the fluid is actually in the tissue spaces between your cells, rather than just in your blood vessels. There are many reasons why your legs might swell at night, and we are going to go through the most common ones step by step. But before that, it is important to know that occasional mild swelling is not always a cause for alarm. If you have been on your feet all day, or if the weather is hot, or if you ate a meal that was high in salt, you might notice some puffiness in your legs in the evening. That can be normal. But if the swelling is happening regularly, if it is worsening, or if it is accompanied by other symptoms like shortness of breath, pain, redness, or warmth in the leg, then you should always talk to your doctor. Those could be signs of something more serious, like a blood clot or a problem with your heart. Now let's look at the most common causes, starting with the heart. The heart is a pump, and it has 4 chambers. The right side of the heart receives blood from your body and pumps it to your lungs to get oxygen. The left side receives oxygenated blood from the lungs and pumps it out to the rest of your body. If either side of the heart is not pumping as well as it should, blood can back up in the veins and cause fluid to leak into the tissues. This is often called heart failure, but that term sounds frightening. What it really means is that the heart is not working at full capacity. It does not mean that the heart has stopped. It means the pumping action is weaker than it should be, and that can lead to fluid buildup, especially in the legs and feet. When you have heart failure, You might notice that your legs swell more as the day goes on, and the swelling is usually worse in the evening and at night. You might also notice that your shoes feel tighter at the end of the day. You might get winded more easily with activity, or you might have to sleep with extra pillows because you feel short of breath when you lie flat. That shortness of breath is a key sign that fluid is also building up in your lungs, and that is something that needs medical attention right away. Another common cause is venous insufficiency. This is a condition where the veins in your legs are not able to return blood to your heart efficiently. The one-way valves inside the veins become weak or damaged, so blood can flow backward and pool in the lower legs. Over time, this can cause the veins to stretch and become varicose veins. But even without visible varicose veins, venous insufficiency can cause aching, heaviness, and swelling in the legs. The swelling is often worse after standing or sitting for long periods, and it improves when you elevate your legs. If you have chronic venous insufficiency, you might also notice changes in your skin, like brownish discoloration around your ankles, or your skin might feel leathery or hard. Now let's talk about the kidneys again, because they are crucial in managing your body's fluid balance. Your kidneys filter about 180 liters of fluid every day, but most of that is reabsorbed back into your bloodstream. They are very sensitive to changes in blood pressure and blood flow. If your kidneys are not functioning well, they may not be able to remove enough sodium and water, and that can cause fluid retention. This fluid retention often leads to swelling in your legs, and it is usually worse at night because when you lie down, your kidneys get a higher blood flow, which can actually increase urine production. But if they cannot excrete the fluid, it stays in your tissues. Sodium is a key player here. Most people eat more salt than they need, and your kidneys have to work hard to get rid of that extra sodium. When there is too much sodium in your blood, your body holds onto water to dilute that sodium. That extra water stays in your tissues and causes swelling. So reducing your salt intake can be one of the most effective ways to reduce fluid retention and leg swelling. This does not mean you have to cut out salt completely, but being mindful of processed foods, canned soups, and salty snacks can make a big difference. Another cause that many people do not think about is medication. Some medications can cause leg swelling as a side effect. For example, blood pressure medications like calcium channel blockers can cause fluid retention in the legs. Non-steroidal anti-inflammatory drugs, or NSAIDs, which are common pain relievers, can also affect kidney function and cause swelling. Even some diabetes medications and hormone therapies can lead to fluid buildup. If you are taking any medication and notice swelling, you should discuss it with your doctor. Do not stop taking any medication on your own, but it is important to know that your medication might be part of the picture. Now let's think about lifestyle factors. As we mentioned earlier, sitting or standing for long periods can lead to swelling because gravity pulls fluid down and the muscle pumps are not active. If you have a job that requires you to stand all day, you are more likely to have swollen legs by the end of the day. If you sit at a desk for hours without moving, the same thing can happen. The swelling is usually worse at night because you have accumulated fluid all day, and when you finally sit down to rest, the fluid has had time to settle in your lower legs. The time of year also matters. In hot weather, your blood vessels dilate, or widen, to help cool your body. That dilation can make it harder for your veins to pump blood back to your heart, and fluid can pool in your legs more easily. So if you notice more swelling in the summer months, that is a common reason. It is not necessarily a sign of a new health problem, but it is something to be aware of. Now let's think about some practical daily habits. Wear shoes that are comfortable and not too tight. Tight shoes can restrict blood flow and make swelling worse. If you notice your shoes becoming tight by the end of the day, consider getting a larger size or wearing shoes that are adjustable. Also, avoid sitting with your legs crossed, as that can compress veins and make it harder for blood to return to your heart. Instead, keep your feet flat on the floor or on a footstool. When you are sleeping, try to keep your legs elevated. You can place a pillow or two under your calves to raise them above your heart. This allows gravity to work in your favor all night. Some people find it helpful to raise the foot of their bed by putting blocks under the legs of the bed frame. This is a more permanent solution if you have chronic swelling. It also helps reduce the frequency of getting up to use the bathroom at night, because the fluid is being reabsorbed and processed more evenly. Now we have covered most of the major causes and self-care measures. Let's move on to other specific conditions that can cause leg swelling, like liver disease, thyroid problems, and more. Liver disease is another important cause of leg swelling. The liver produces a protein called albumin, which helps keep fluid inside your blood vessels. If your liver is damaged, it cannot make enough albumin, and fluid leaks out into the tissues. This is a common reason for swelling in the legs, but it often also causes swelling in the abdomen, which is called ascites. If you have liver disease, you might notice your belly getting larger along with your legs swelling. You might also see yellowing of the skin or eyes, which is called jaundice, or you might feel very tired and weak. Liver disease can be caused by many things, including heavy alcohol use, viral hepatitis, or fatty liver disease. Treating the underlying condition is the key to reducing the swelling. Thyroid problems can also cause swelling. The thyroid is a butterfly-shaped gland in your neck that regulates your metabolism. If your thyroid is underactive, a condition called hypothyroidism, your metabolism slows down. This can lead to fluid retention and swelling in your legs, as well as weight gain, fatigue, and feeling cold all the time. Hypothyroidism is more common in women and in older adults. Your doctor can check your thyroid function with a simple blood test. If you have an underactive thyroid, medication can restore your thyroid hormone levels and help reduce the swelling. Now let's talk about something called lymphedema. The lymphatic system is like a drainage system for your body. It collects excess fluid, proteins, and waste products from your tissues and returns them to your bloodstream. If the lymphatic system is damaged or blocked, that fluid can accumulate and cause swelling. This is called lymphedema. It can happen after surgery, radiation therapy, or an infection. It often affects one leg more than the other. The swelling from lymphedema is usually firm and does not pit easily when you press on it. It can also cause your skin to thicken or become hard. Lymphedema requires specialized care, including manual lymphatic drainage massage, compression bandaging, and sometimes pneumatic compression pumps. If you think you have lymphedema, you should see a lymphedema specialist or a vascular doctor. Infections can also lead to swelling in the legs. Cellulitis is a bacterial infection of the skin and the tissues under the skin. It can cause redness, warmth, swelling, and pain in the infected area. It often starts in a small cut or crack in the skin, especially between the toes. If you have cellulitis, you might also have a fever and chills. Cellulitis is a serious infection that requires antibiotics, and if it is not treated, it can spread to the bloodstream. So if you notice a red, swollen, and warm area on your leg that is spreading, you should see a doctor right away. Now let's consider some less common causes. Some medications can cause swelling as a rare side effect. For example, some hormonal therapies, like estrogen or testosterone, can cause fluid retention. Some antidepressants can also cause swelling. If you are taking any medication and notice swelling, you should not stop the medication abruptly, but you can discuss it with your doctor. They might be able to adjust the dose or switch you to a different medication that does not cause this side effect. There is also a condition called chronic venous obstruction, where a major vein in your leg is compressed or blocked. This can happen in a condition called May-Thurner syndrome, where the right iliac artery compresses the left iliac vein. This causes swelling in the left leg, often with pain and discoloration. This is more common in women and can lead to blood clots. It can be treated with stents to open the vein. So if you have swelling that is mostly in one leg, especially the left leg, and it is accompanied by pain, you should see a specialist for imaging. Now let's go back to the heart, because it is so important. When we talk about heart failure, we need to understand the difference between right-sided and left-sided heart failure. Left-sided heart failure is the most common form. In left-sided heart failure, the left ventricle cannot pump blood effectively, so blood backs up into the lungs. This causes shortness of breath, coughing, and difficulty breathing when lying flat. Right-sided heart failure often happens as a result of left-sided heart failure, but it can also happen on its own. In right-sided heart failure, the right ventricle cannot pump blood to the lungs effectively, so blood backs up into the veins and causes swelling in the legs, ankles, and abdomen. So if you have both shortness of breath and leg swelling, that strongly points to heart failure. If you have swelling in your legs and you are also experiencing chest pain, palpitations, or dizziness, those are signs that your heart may be under severe stress. You should not wait to see your doctor. Go to the emergency room. Similarly, if you have sudden severe swelling, pain, and discoloration in one leg, that could be a blood clot. Do not try to massage the leg or exercise it. Just go to the Now let's talk about how your doctor will evaluate your swelling. They will start with a thorough history. They will ask you when the swelling started, how often it happens, and what makes it better or worse. They will ask about your medical history, including high blood pressure, heart disease, kidney disease, liver disease, and diabetes. They will ask about your medications, diet, and lifestyle. They will also ask if you have any other symptoms like shortness of breath, fatigue, or pain. Next, they will do a physical exam. They will check your blood pressure, and they will listen to your heart and lungs. They will examine your legs for swelling, skin changes, and pitting. They might use a Doppler ultrasound to check the blood flow in your legs. They will also look at your eyes, skin, and nails for signs of underlying conditions. Blood tests are essential. They will check your kidney function with creatinine and BUN levels. They will check your liver function with albumin, AST, and ALT. They will test your thyroid function with TSH. They might check a BNP or NT-proBNP level, which is a marker for heart failure. If that level is elevated, it suggests that your heart is under strain. They might also check your complete blood count and your electrolyte levels, especially sodium and potassium. A chest X-ray can show if your heart is enlarged or if there is fluid in your lungs. An echocardiogram, or echo, is an ultrasound of your heart. It shows how well your heart chambers are functioning and if the heart valves are working properly. It is one of the best tests to evaluate heart failure. They might also order a venous Doppler ultrasound of your legs to look for blood clots. If they suspect liver disease, they might do an ultrasound of your liver. Once your doctor has identified the cause of your leg swelling, they will recommend a treatment plan. That plan may include lifestyle changes, medications, or procedures. For heart failure, the treatment often includes a combination of medications like ACE inhibitors, beta blockers, and diuretics. These medications help your heart pump better, lower your blood pressure, and remove excess fluid. For venous insufficiency, the treatment might include compression stockings, leg elevation, and sometimes procedures to close off abnormal veins. For kidney disease, the treatment focuses on protecting the kidneys and managing fluid balance, which may include diuretics and a low-sodium diet. For liver disease, the treatment targets the underlying cause, such as stopping alcohol intake, losing weight, or taking antiviral medications. Now let's discuss what you can expect from treatment. If you are started on a diuretic, you will notice that you urinate more frequently. That is the medicine working, helping your body remove the extra fluid. You may also notice that your swelling starts to decrease within a few days. It is important to weigh yourself daily, because changes in weight are a good indicator of fluid balance. If you gain more than 2 pounds in a day or more than 5 pounds in a week, that could mean you are retaining fluid, and you should call your doctor. They might need to adjust your diuretic dose. The same principle applies if you are managing your swelling without medication. Weigh yourself at the same time every day, preferably in the morning after using the bathroom. Track your weight over time. This helps you catch fluid retention early, before it becomes severe. A sudden weight gain is often the first sign that your body is holding on to extra fluid. Now let's revisit the role of diet and sodium restriction. It is not just about not adding salt to your food. You need to be aware of hidden sodium. Processed meats like deli turkey, ham, and sausage are very high in sodium. Canned vegetables, soups, and broths often contain large amounts of added salt. Even breads and baked goods can have surprising amounts of sodium. Start reading nutrition labels. Look at the sodium content per serving. If the label says low sodium, it means less than 140 milligrams per serving. If it says reduced sodium, it means at least 25% less than the original product, but it might still be high. Aim for foods with less than 500 milligrams of sodium per serving and limit your total daily intake. Potassium is important too. Potassium helps your body excrete sodium and balance fluid. Many fruits and vegetables are high in potassium, such as bananas, oranges, potatoes, spinach, and avocados. If you are taking diuretics, your doctor might recommend increasing your potassium intake, because some diuretics can deplete potassium. But if you have kidney disease, your potassium levels might already be high, so you should be careful with potassium supplements and foods high in potassium. Always talk to your doctor before making any changes. Another nutrient to be aware of is magnesium. Magnesium helps regulate electrolyte balance, and a deficiency can contribute to fluid retention. Good sources of magnesium include nuts, seeds, whole grains, and leafy greens. If you are not getting enough magnesium, a supplement might help, but again, you should ask your doctor first. Now let's talk about protein. Albumin is a protein made by your liver, and it helps keep fluid inside your blood vessels. If you have low albumin levels, you might develop edema. Low albumin can happen with malnutrition, liver disease, or kidney disease where you lose protein in your urine. If you have low albumin, your doctor might recommend increasing your protein intake through foods like lean meats, poultry, fish, eggs, beans, and dairy products. But if you have kidney disease, you might need to limit protein, so this is something you should discuss with your doctor. Now let's talk about exercise more specifically. Physical activity helps your circulation and reduces fluid retention, but it is important to choose the right type of exercise. Walking is excellent. It activates the calf muscles and helps pump blood up the legs. If you are not used to exercising, start with short walks, maybe just 5 or 10 minutes, and gradually increase the time. Swimming and water aerobics are also great because the water pressure helps your veins pump blood upward, and the buoyancy supports your joints. Leg lifts and ankle pumps are simple exercises you can do even while sitting. Lift one leg at a time, and point and flex your toes to activate your calf muscles. Do this for a few minutes every hour. If you have heart failure, it is important not to overdo it. Exercise should be gentle and tailored to your condition. Ask your doctor about a cardiac rehabilitation program. These programs provide supervised exercise and education to help you manage heart failure safely. If you have venous insufficiency, walking is one of the best things you can do, but you might also want to avoid high-impact activities that put stress on your joints and veins. Now let's think about skin care. Swollen legs can put strain on the skin, making it more vulnerable to injury. The skin may become stretched and thin, and it can crack easily. Keep your skin clean and moisturized. Use a gentle, unscented lotion or cream, especially on your feet and ankles. If your skin is dry, it can crack, and that crack can be a gateway for infection. Check your feet daily for any cuts, blisters, or redness. If you cannot see the bottoms of your feet, use a mirror or ask a family member for help. Wear comfortable, supportive shoes that do not rub or pinch. If your feet are swollen, you might need a wider shoe. Avoid going barefoot outside, as that can lead to injuries. Also, trim your toenails carefully to prevent ingrown nails. If you have diabetes or poor circulation, you should have your feet checked regularly by a podiatrist. Even a minor skin break can lead to a serious infection in someone with a swollen leg, because the circulation is already compromised. Now let's talk about when to see your doctor and what to tell them. If you are experiencing swelling at night, keep a journal. Write down when it happens, what you ate that day, how much you exercised, and any other symptoms you have. Bring that journal to your appointment. It helps your doctor connect the dots. For example, if you notice that the swelling is worse after a salty meal, that is a very clear sign that sodium is contributing. If it is worse after a long car ride, then you know that inactivity is a factor. When you see your doctor, be honest about your diet, exercise, and lifestyle habits. There is no judgment. They need accurate information to help you. If you are taking any over-the-counter supplements or medications, bring the bottles with you. Many supplements, like licorice root or ginseng, can affect fluid balance. Even common pain relievers like ibuprofen can cause fluid retention. Your doctor needs a complete picture. Now let's consider long-term management. Many causes of leg swelling are chronic, meaning they require ongoing care. But that does not mean you have to live with uncomfortable swelling forever. With the right combination of lifestyle changes, medications, and treatments, you can keep the swelling under control and improve your quality of life. It may take some trial and error to find the right combination for you, but it is worth the effort. If you have heart failure, managing your condition is a lifelong journey. It involves taking your medications consistently, monitoring your weight and symptoms, following a low-sodium diet, and staying active within your limits. You may also need to limit your fluid intake. Your doctor will give you a specific target for daily fluid intake, often around 1.5 to 2 liters. That includes all fluids, not just water. So if you drink soup, that counts as fluid. Keeping track of your fluid intake can feel tedious, but it is a key part of preventing fluid buildup. Now let's look at some common questions. People often ask if sleeping with their legs elevated is enough. It is helpful, but it is usually not enough on its own if there is a significant underlying cause. Elevation helps the fluid drain, but it does not address the cause of the fluid retention. So while you should continue to elevate your legs, you also need to address the root problem. If you have venous insufficiency, compression stockings and exercise are important. If you have heart failure, medications and dietary changes are essential. Another common question is whether drinking more water helps or hurts. If you have heart failure, your doctor may ask you to limit fluids. If you have normal kidney function and no fluid restriction, drinking enough water can help your kidneys excrete sodium and reduce retention. But you should never drink excessive amounts of water, because that can overload your system. Follow your doctor's advice on fluid intake. If you are not sure, ask. Some people ask if they should stop eating salt completely. The answer is no. Your body needs some sodium to function, but most people eat much more than they need. So the goal is not zero sodium, but to reduce it to a healthy level. The key is to be mindful and to choose fresh, unprocessed foods as much as possible. You can still enjoy flavorful meals by using herbs and spices instead of salt. Lemon juice, garlic, onion powder, oregano, and basil can add a lot of flavor without the sodium. Now we should talk about edema and sleep apnea. Sleep apnea is a condition where your breathing stops and starts repeatedly during sleep. It causes your oxygen levels to drop, which can put stress on your heart and lead to fluid retention. In some cases, treating sleep apnea with a CPAP machine can actually reduce leg swelling. If you snore loudly, feel very tired during the day, or wake up gasping for air, you might have sleep apnea. It is worth mentioning to your doctor. Treating sleep apnea may be a missing piece in managing your swelling. Now let's discuss the emotional and psychological impact of leg swelling. It can be frustrating and worrying. You might feel self-conscious about how your legs look. You might find it difficult to wear your favorite shoes. You might worry that it is a sign of something more serious. It is normal to feel that way, but knowledge is power. Understanding what is happening in your body can reduce your anxiety and help you take control. Remember, you are not alone. Many people have this issue, and there are effective treatments. If you are a caregiver for someone with leg swelling, your support is invaluable. You can help them elevate their legs, remind them to take their medications, and prepare low-sodium meals. You can also help them track their weight and symptoms. Caregiving can be stressful, so remember to take care of yourself too. Joining a support group or talking to a counselor can help you manage your own feelings. If you are a caregiver for someone with leg swelling, your support is invaluable. You can help them elevate their legs, remind them to take their medications, and prepare low-sodium meals. You can also help them track their weight and symptoms. Caregiving can be stressful, so remember to take care of yourself too. Joining a support group or talking to a counselor can help you manage your own feelings. When you are strong and calm, you are better able to support the person you care for. So do not overlook your own well-being. Now, let us bring everything together in a way that is simple and easy to remember. We have talked about many causes, from the heart and the veins to the kidneys, the liver, and even the thyroid. But the most important message is this: leg swelling at night is a signal. It is your body's way of saying that the fluid balance is off, and it needs your attention. The good news is that you have a great deal of control over this situation. You are not a passive bystander. You are an active participant in your own health. Think of the plan we outlined as your daily toolkit. First, know your numbers. Weigh yourself every morning and write it down. A sudden jump in weight is the earliest warning sign that fluid is building up. Second, watch your salt. This is the single most powerful dietary change you can make. Read labels, cook fresh, and flavor your food with herbs and spices instead of the salt shaker. Third, keep your legs moving. Walk, pump your ankles, and avoid long periods of sitting or standing without a break. Fourth, use gravity to your advantage. Elevate your legs whenever you can, especially in the evening and while you sleep. Fifth, if your doctor recommends compression stockings, wear them consistently, starting first thing in the morning. These habits work together. They are like a team that supports your circulation, relieves the pressure on your veins, and helps your kidneys do their job more effectively. Do not try to change everything at once. Pick 1 or 2 steps to start with, and build from there. Small, consistent changes add up to big improvements over time.